Very good evening, everyone. Welcome back again to our MISI Care Online Health Talk. In conjunction to Care for Your Heart Week month, we want to present to you how to care for your heart. Now, for the next 30 minutes or so, we'll go through the heart structure, what is the commonly known as heart attack, the causes, and we will elaborate more about plaque or arteriosclerotic disease, risk factors, symptoms, investigation, treatment, and prevention. What is heart? Heart actually is a muscle organ about size of the fist, lies in the center of the chest. It pumps blood rich in oxygen and nutrient to all parts of the body. And it's nourished by a system of the blood vessels, arteries. We mainly call it left and right coronary artery disease. Left and right coronary arteries lie on the surface of the heart, as you can see from the cartoon here or the picture here. And when we talk about heart problem or heart disease, referring to the coronary artery disease, these vessels are blocked, right? So what is heart attack? It happens when the blood flow to the heart muscle is stopped for a few minutes and cause damage resulting in the heart attack. So obstruction to the blood flow can be due to the thickening or narrowing of the arteries, the mainly coronary arteries we are talking about. And when this happens, the heart muscle does not receive adequate blood supply and oxygen, and therefore the cells around that area will die. And heart attack sometimes is called acute myocardial infarction, or in short form, we call it AMI. That's medical terms. And you can see here, the vessels overlying the heart, which is called coronary artery, there's an arteriosclerotic plaque, and the plaques build up and then block the vessels and cause damage to the muscle. And you can see if you open the heart out during the autopsy specimen, you can see that this whole area is whitened. That means the whole area of the muscle already dead, right? And how does it occur? Mainly because of build-up of the fatty deposit and combined with the fibrous tissue or scar tissue, we call it plaque, inside the wall of these coronary arteries. And this plaque can just crack and bleed. And when this bleed, will create total obstruction or cause clot in the vessels and total occlusion of the blood to the supplying to the heart muscle. And these plaque actually are very vulnerable and mainly due to the arteriosclerosis. Cholesterol, smoking, diabetic hypertension cause the forming of the arteriosclerosis. You can see the cross section. The vessel is already thickened inside the lumen, and a lot of plaque being formed. And sometimes this plaque can rupture and cross the blood clot. You see the red color in the center of the lumen actually is blood clot and total occlusion of the arteries, right? And this is a progressive disease, start from the normal vessel due to the smoking, due to the cholesterol, due to diabetic hypertension. And over the years, this plaque will eventually form. And these are the arteriosclerotic plaque and can occlude the lumen. And these plaque actually are not a stable structure. It can just crack and then cause blood clot forming there, right? And you can see that from this illustration, arteriosclerotic forming and suddenly it ruptured and then cause a block to the vessels. And therefore, the flow cannot reach the heart vessels, heart muscle, and cause heart attack. So other causes besides arteriosclerotic plaque, also due to the some blood tend to clot. For example, leukemia patient, high red blood cell patient, they tend to clot the blood. Or the artery itself can cause inflammation due to, like, for example, SLE, rheumatoid arthritis, cocaine abuse, and certain syndrome due to the artery can cause spasm or suddenly contraction and cause the impaired blood flow. Some other clot from other part of the, for example, from the other area can cause a small embolus and then block the vessels. Very rare, like congenital abnormality of the coronary artery can cause a heart attack as well. So mainly we talk about risk factor. Knowing the risk factor, then we can take preemptive or preventive measurement to reduce the risk factor. For example, high cholesterol level is well known to be one of the major risk factors for heart attack. High blood pressure, diabetic, strong family history of early coronary artery disease or heart attack. Smoking definitely is one of the major cause. Obesity and physical inactivity. Not much of exercise also, sedentary lifestyle also lead to heart attack risk. And common symptom, well, common symptom, you're talking about commonly chest pain over the central chest area. And it may spread, it may not necessarily all the time. It may spread to the arms and jaw and neck. And it is associated with the sweating episode, cold sweat. Sometimes the patient may feel like vomiting. They feel giddiness, palpitation, and sometimes they can feel breathless. They cannot catch their breath. Somehow, you have to be aware that some patients may not have these typical symptoms. They present atypical symptoms. Last few months, I've seen one patient with the pain over the behind the ear, and actually it's the heart attack symptoms. So symptoms may vary. Of course, we talk about typical one that commonly seen. There are two types of angina. One is stable. It's precipitated by certain exertion after or even a large meal, and it will stop spontaneously after 1 to 5 minutes by resting. And it's usually due to the smooth plug and it didn't rupture. So this is a stable angina. The other one is more scary one. It will be acute coronary syndrome or unstable angina. It can be sudden acute attack, more dangerous. The plug tear or break and rupture and cause sudden occlusion of the vessels. And it causes a heart attack, severe full-blown heart attack, we call it myocardial infarction. Or it has not caused a severe disease and that is called unstable angina, right? So how do doctors diagnose it? We diagnose it with first of the ECG or EKG, where you put all the wires on the chest and then look at the wave pattern of the heart. And from there, we can see the pattern that can roughly know which vessel is being blocked. And of course, we do some blood tests, for example, cardiac enzyme and also troponin T. With more and more advanced technology, we'll be able to detect it early. For those survive from the heart attack or very mild symptoms, we can use certain confirmation tests. For example, nuclear stress test, use echo, something like ultrasound to look at the heart, whether how's the contraction, any part of the wall that is not moving well. So from echocardiogram, we can tell which part of the heart was damaged before. And commonly used will be the commonly screening tools that we use to detect heart problem will be exercise stress test or treadmill. So we detect the changes of the electrical patterns in the heart muscle during the exercise, during which the heart muscle need a lot of oxygen supply. Should the vessels to the heart, there are some partial occlusion, there you can see that the muscle deprived of the oxygen can show certain electrical patterns. And this is how we pick it up, which part has blockage, right? This exercise stress test. And of course, gold standard will be coronary artery angiogram, where the cardiologist will inject a certain dye into the body and into the coronary artery to see any blockage. During the procedure, the cardiologist will be able to identify it and use balloon to dilate it and put a stent and treat at the same time. So we can see from the picture here, it outlines the vessels of the heart and you can tell which one is already occluded, right? If during the emergency treatment, we use so-called clot buster, you use the certain medicine to dilute and dissolve the clot for emergency purposes. And nowadays, if you reach it early, the cardiologist may want to do primary angioplasty, means that they'll go in during the heart attack time, relieve the clot and balloon it, and then put a stent in, right? And usually, this heart attack may come with the arrhythmia, abnormal heartbeat of the heart. So we will use a certain medicine to control it as well. And if it's severe heart attack, it may cause heart failure during that time. So we use certain medicine to control the heart failure. And nowadays, we definitely use a lot of blood thinning pill. Aspirin is just one of them, but with more advanced technology, we have better pills to dissolve or thin the blood. Nitrate, another medicine to open up the vessels. And we go standard unless it's contraindicated. Otherwise, we use a beta blocker We heard a lot about beta blockers to treat high blood pressure, but cardiologists use a lot for beta blocker for in stabilizing the heart attack, right? Of course, beside all the treatment, the mainstay is still to ask, educate the patient for a lifestyle change. For example, weight loss in obese patient, and they have to quit smoking, diet medication to lower the cholesterol. Then they are advised how to improve their exercise load and regular exercise and reduce the stress as well. Cholesterol lowering medicine, there are many right now, mainly are statins. Definitely have a great impact in reducing the risk of heart attack and death, and it's proven again and again. It lower the low density cholesterol and improve the good cholesterol, so-called high density cholesterol. And it prevent blood from tearing or breaking and causing the occlusion of the vessels. So therefore, it decreases the chance of acute coronary syndrome or acute heart attack. Treatment, as I mentioned earlier, the majority of the cardiologists now will be able to do even complicated disease. We call it percutaneous transluminal coronary angioplasty. Something like exactly like what we mentioned is angiogram. During the angiogram procedure, they put a balloon in, dilate the lesion, and put a stent in, right? So this is a PTCA. This is how it look like. You see the yellow color actually is a plug. Then the cardiologist put a balloon inside there, inflate the balloon, open the plug and the narrowed vessels. And after that, they pull out the balloon. Then they put a stent in, expand the stent. Then the stents act as a spring and open up. So keep the vessel patent, right? So this is a PTCA with stenting. Now, if certain disease is too many blockage, too many vessels involved, PTCA may not be the option. So the cardiologist may refer to cardiothoracic surgeon for bypass. So we call bypass, coronary artery bypass surgery. And they graft one or more vessels onto the affected coronary arteries to bypass the narrowed or blocked areas. So it breach it, go through bypass straight away. And the graft can be taken from artery inside the chest, artery in the arm, or from the long vein in the leg. So this is coronary artery bypass surgery. And you can see that they use a vein here to bypass from the aorta to bypass the area, blockage area, and go distal to the vessels, right? This is a bypass. Of course, prevention is better than cure. We always encourage, don't let it happen. The best start from prevention. So those who are smoking, quit smoking, eat a healthy diet, and reduce the high cholesterol diet, the bad cholesterol. Like for example, cut down all the oily stuff, fried stuff, fast food, egg yolk, all right? And those with the blood pressure have to check the high blood pressure, have to check their blood pressure regularly, make sure that it's well controlled. For those who have not high blood pressure, detect it early, always check, go for a regular checkup. And the regular checkup is important because, like for example, stress test will be able to pick up the early disease even though the patient has no symptom. Regular exercise improves the cardiac workload. Relax and take a vacation. Right? Thank you very much.